upload it to Discord.
Yeah.
Some of this I'm going to say that would just be verbally done. Okay? Let me know when you guys are ready.
Go. Action.
Okay. Hi, Mr. Hisler. How are you? My name's Aaron. I'm going to be a nurse today. I'm going to come in and ask you a few questions, okay? But before I do that, let me just go ahead and verify your name and date of birth.
Name is Sam Hipster. Date of birth is January 2, 1944.
Okay, perfect. Let me just wash my hands real quick, which I should have done first. Okay. And Mr. Hipster, do you have any allergies?
No
Okay.
allergies, no.
Alrighty. Okay, so Mr. Hipster, let me go ahead and just grab a set of vitals. I'm going to grab your vitals real quick. So I'm going to grab your temperature, your heart rate, your blood pressure, your oxygen saturation level, and then are you in any pain right now? I see that you came in with a right knee issue, and we're preparing you to go to the OR. So, you're experiencing any discomfort in that right knee?
Yeah, just a little bit of pain in my right
Okay.
knee now.
On a scale of 1 to 10, 1 or 0 to 10, 0 being no pain, 10 being the most pain, how bad would you say that pain is?
It's like 5.
Okay. And how would you describe that pain? Throbbing, sharp? Describe it for
Like
me.
a sharp, tingling pain.
Okay. All right. Perfect. All right. Well, thank you for letting me take your vital signs. I'm going to go meet with my clinical instructor, and I'm going to review your medications. I'm going to grab the medications as we prepare them, and then I'll be back to see you. Okay? All righty. Now she's the clinical instructor, okay? Okay. Clinical instructor Chelsea, right? We need to go through these medications, okay? Check number 1, okay? Reviewing the order. So I see Sam Hipster came in. He's on our orthopedic unit with a right knee issue. Looks like he's going to be having an elective right knee replacement. Condition's currently stable. From a care perspective, his vital signs are being completed every 4 hours, so I just grabbed his vitals. His temperature was 97.8, 68. BP was 128 over 62. O2 sat was 96% of 2 liters, and he has 5 out of 10 pain in the right knee. You said 5?
Yes.
Okay. All right, 5 out of 10 pain in the right knee. Outside of that, I checked his lower extremity pulses, right? Per the order, I've got to walk through that. Or you know what? I haven't checked that. I don't want to lie. All right, I'll go back and do that after I provide his medication because it's not relevant right now. And I did note that he has an anti-embolic stocking on the left leg and also SCDs, which are sequential compression devices. So we're preparing him for the OR this morning. I had actually asked the secretary. Looks like he's on the OR schedule for 12:30. Okay, so this is where it's going to get interesting because I'm going to give you guys all the answers. So I'm not going to give you the answers. Okay, so he's currently on bed rest and he's NPO. He also has an IV infusion of normal saline running at 75 an hour. I did note that that was running. He has a right AC 20 gauge IV. Okay. On behalf of the medications, let's just take a look at the order and I'm going to walk through those and I'm going to verbalize the 6 rights to you, okay? So Sam Hipster is my patient. I've verified his identity and his date of birth. He also has no known drug allergies, okay? So digoxin is a medication for blank, okay? The dose is 0.25 milligrams. He's receiving that PO, which is orally or by mouth, and he's getting that medication daily, okay? ... You guys with me? Okay. The second medication, okay? Once again, Sam Hipster, his date of birth, I verified. So once I've stated that, there's no need to go back to the right patient. We've already done that, verbalized that. So I'm going 2 through 6 for each medication. Second medication is erythromycin, okay? This is a blank antibiotic and it's being used for X, okay? It's currently ordered and prescribed at 500 milligrams PO, which is by mouth or orally. And it looks like the frequency is Q12 hours, which is every 12 hours. ... Okay? Third medication that he'll be receiving is actually 2 separate medications, 2 variations of insulin. Humulin R, which is regular insulin at 5 units, and then Humulin NPH 5 units, and it's before each meal, okay? Not giving you guys the answers, right? And then the fourth medication is morphine, 2 milligrams. It's being given via the intramuscular route, and it's every 6 hours as needed for pain greater than 6, okay? Morphine is X class, and the reason why he's on that is for pain, all right? Once again, ... right? So there are my 6 rights. in between that, there's a lot of other questions, right? So I'm not gonna give you guys those answers today. You all with me, okay? So there's check number 1, okay? It's validated, I've expressed it, I've walked them through. What I would do with each medication is where I need clarity, I would pause and I would note that down, okay? So I'm not gonna call the provider for every single med. I'm gonna summarize what I need, call, and then give an SBAR report. Situation, background assessment, recommendation, okay? So I would walk through and clarify all 4, yeah.
I forgot.
Yeah, that's how you communicate. Situation, background, assessment, recommendation, right? I would call the provider. Dr. Chelsea, I'm calling you. I have Mr. Sam Hipster here. His date of birth is 1/2/1944. He's on 4 West, the orthopedic unit here at Providence Tarzana Medical Center. And he's in room 502. This is your patient, right, Dr. Chelsea?
Yes.
Okay, so I'm calling you to clarify X, okay? On behalf of that, can you go ahead, is that correct, or would you like me to change that order?
That seems to be correct.
Okay, and the next medication, I noticed this discrepancy, okay? I may need X parameter for this medication. Can you go ahead and provide me a parameter for that medication? Provide me the parameter, okay? And then additionally, I've noticed these other 2 deficits with your order, and I just want to clarify that we have X and Y, right? And that I need to clarify that with you before I give this medication, okay? So can I receive clarification? Here's the clarification, okay? There's my SBAR communication, right? There it is, that's check number 1. Moving to check number 2, okay? So now I'm pulling the meds. The meds are gonna be in front of me, right? So now I'm physically going back to the med, I'm checking the med. We've already verified our 6 rights. The additional aspects you have to verbalize to us is the meds will come in variations. So even though I'm not gonna force you to go back through the 6 rights again, okay? You would tell me that you would. You do have to tell me how much of each medication you will need, okay? That'll make sense orally, right? Then the med math problem exists. So you're going to have the dose of the morphine there, as well as the insulin. As you move past that and you collect the medications and you're ready to go, then we're gonna prepare the medications, okay? And preparing the meds, that's going to be everything we practiced today, all right? When you prepare the medications, we're looking for, aseptic technique, making sure you're not contaminating anything, and then verbalizing what you're doing. I'm entering the vial with a one-hand technique. I've drawn up, 8 units or 10 units of negative pressure. I'm gonna enter the MPH first, 5 units. I'm gonna stabilize the vial, pull it out, go into the regular, 5. I'm gonna tip the vial with a one-handed technique. I'm gonna draw my 5 units. Here are my 5 units. I'm gonna pull this back out, go down, pull, go into MPH. You guys with me? Okay. Then show us the recap on the insulin, right? Recap, put that down. Then you go and prepare your IM medication. Prior to the preparation, I would work you through the med math problem. So you have the dose, right? What I may do is you're gonna have the vial, right? And what I likely will do is I may even change the dose for the purpose of draw, okay? For the purpose of the exercise, and I will definitely change the volume in what I tell you in terms of what is physically dispensed. So this is 4 milligrams in 1 ml. This is 6 milligrams in 2 ml, whatever the case may be. So you have to do the med math, okay? Third check. Now I go back, knock, knock, wash my hands. Hey, what's up, Sam? How are you? Good to see you again. It's me, Aaron, your nurse. I'm gonna come back in. I've got your medications ready, and my clinical instructor's with me. I went over all the medications. Everything looks like it's okay. I've also clarified X, Y, and Z with the licensed practitioner to make sure that everything was correct as ordered. And I'm just gonna check a few additional things, okay? So I obtained your vital signs, but I also need to do one additional thing, okay? And I'm gonna have to, assess you, all right? Is that okay?
Yeah, it's okay.
Sure. I assess Sam Hipster. Now I'm ready to go, okay? After that, now I'm walking Sam Hipster through. Hey, Sam, are you okay to swallow these medications?
Yes.
Okay, and I've got 2 pills for you. Are you okay to take all the 2 at the same time?
Yes.
Would you take it with water, or do you prefer applesauce? What would you like?
With water.
Okay, sure. Here's the cup. Here's the medications. Go ahead. And let me just see that you swallowed the medications. Perfect. All right, Sam, I also have your insulin here. In this, syringe, I've got 2 different types of insulin, X and Z, okay? I give the insulin. I walk them through. I'm going to physically inject. Sam, you said that you're in 5 out of 10 pain. Per this order, right, it would be greater than 6 to give the morphine, right? And then you'd physically administer the morphine and walk me through the same steps, okay? Sam, I really appreciate your time. I'll be back in X amount of time to follow up with you on the basis of what I just provided you. Is there anything else I could do for you before I step out?
No.
Are you comfortable?
Yes, I'm
Do you need to use the restroom?
No, I'm good.
All right, and your personal belongings are close enough to you?
Yes.
All right, great. Foam out. I'm gonna go document my administration, and I'll be back in X minutes, X hour. Okay? Thanks, Sam. That's it.
That's a long one.
How long did I
It's 11, almost 11, 10:49.
You had to explain stuff. So